We work on the salivary gland, which is an organ that makes more than 1.5 liters of saliva a day. And what we like to remind people is that you never really appreciate your salivary glands until you no longer have their function. And in the case of patients who are diagnosed with head and neck cancer and then treated with radiation therapy, this is a very serious condition. In the absence of saliva, these patients not only have trouble with eating and speaking and swallowing, but they also almost always end up losing their teeth.
The current view in the science field of salivary glands is that we have some specialized stem cells that should give rise to the cells that are actually producing the saliva. So the idea is that if we could identify the stem cell, we can use them to regenerate the salivary gland.
Our work was centered on the idea that those stem cells must be there, and a lot of putative stem cells have been identified, but none has been definitively characterized as the salivary gland stem cells. So what we did was to ask the question, what exactly is the contribution of stem cells to renewal, normal maintenance of the salivary gland? And what we found was that there is, in fact, very little evidence for contribution of a stem cell. What we found is that the secretory cells that are producing the saliva are actually replicating themselves without a lot of stem cell contribution at all.
We used a genetic mouse model that allows us to label single cells in one of 4 colors. When labeled cells divide, their descendants are also labeled with the same color. We found that when we label single secretory cells, over time they turn into larger clusters of the same color. This directly shows that they are self-duplicating.
This has led us to propose a revised model for salivary gland homeostasis, which is not necessarily dependent on stem cells. Although we haven't ruled out that there might be stem cells in the salivary gland, what we have shown is that the salivary glands can maintain themselves without this putative stem cells under normal conditions. We, at the present time, do not have a way to regenerate the salivary glands. All treatments are palliative and temporary. And so in looking for a way to help those patients who already have xerostomia and no salivary gland function anymore, going forward, we perhaps don't have to try to look for stem cells. We can perhaps use these self-duplicating acinar cells, perhaps even of the patients prior to radiation therapy. The reason this is important is because a huge amount of resources is going into treating these patients now, trying to keep them healthy, and at present there is no good way to do that on a permanent basis. So we're excited that perhaps this new idea that you don't have to look for a stem cell in order to regenerate the salivary glands might be a different way forward.